Hi, my name is Vanessa. I'm a respiratory care student from Malcolm X College, and I am here today to talk to you about full ventilatory support. So, what is full ventilatory support? It's when the mechanical ventilator assumes all the work of breathing for the patient. Patient participation is not required. Being said, it provides the patient with the minute ventilation and the FiO2 required to normalize and stable blood gases. To have a patient on full ventilatory support, we do have to follow some initial settings. For example, the tidal volume. Patient's tidal volume is 6 to 8 mLs per kilo of the patient's idle body weight. For patients with ARDS, we follow 4 to 6 mLs per kilo of patient idle body weight, and this is a lung protection strategy. So for instance, we take the patient's idle body weight times a range, one of our ranges, which we chose 7 mLs per that kilogram, and that will give me the tidal volume that I will set into my ventilator, and I will round to the nearest tenth. For frequency, it is normally set at 12 to 16 breaths per minute. In ARDS patients, we set 20 to 25 breaths per minute, and this is with low tidal volumes. Our flow, which is the speed at which the ventilator will deliver that tidal volume. We go ahead and calculate that flow with the patient's tidal volume. We convert that into liters over our I time times 60 seconds because we want to convert this into minutes. So this will equal our flow in liters per minute. Our IE ratio, we set this at 1 to 2, 1 to 3, or possibly longer E times. FiO2s, we set these at 40 to 50%, and we titrate down. We want to avoid FiO2s greater than 60% to prevent any O2 toxicity. Our sensitivity, this parameter makes it easy or hard for the patient to trigger the machine in inspiration if it were to start spontaneously breathing. So we set this at -2 centimeters of water. Our PEEP, we set this in 5 to 8 centimeters of water. In conclusion, full ventilatory support will provide full ventilation with no need of patient participation with the set parameters. For example, if the patient is in assist control volume control, this mode of ventilation will provide the patient with a preset tidal volume according to the frequency we set, and we can call this a mandatory time-triggered breath.